Okay, welcome to Breast Changes Month. I am chatting with Dr. Tanya McEachern. Tanya, tell us what you do, who you are.
Hey everybody, I am a naturopathic doctor in Ontario, Canada, and I treat a ton of women's health, specifically women in that sort of perimenopausal period.
Awesome. So, as we go through kind of perimenopause, menopause, a lot of us find that our breasts change. Some people find they get pain, some people find their breasts get bigger, maybe saggier, maybe more full. There's a lot going on, isn't it?
Yeah, there can totally be a lot going on. I find that tenderness is a really common symptom, especially in women who they might have already been a bit fibrocystic going into menopause. That can kind of increase. Yeah.
Yeah, and I mean I see this in the hub group, really often people going, oh my God, it's just so painful. And
Yeah.
how do I get on top of this? And oh my God, I've got to buy a bigger sized bra and just
Yeah.
all these things that I don't think any of us expected before
Yeah.
we before we got to I think a lot of us thought, well, it'll be some hot flushes and then our periods will stop and it'll be fine.
Right.
And suddenly we're
Right.
like,
Right.
whoa, hold on a minute.
Yeah.
So what can we where shall I ask this question? How do you, within your kind of toolkit of naturopathy, how what information are breast changes giving you?
Yeah. Great question. The breasts are really a window, like a very big window into the lymphatic system. Everybody knows about all the lymph nodes that are in, the armpit area, right? And the breasts are really interesting because they drain into all four quadrants. They've got lymph node drainage in all four. But of course, out the axilla, the armpit area, is the main drainage route. So the breasts are often, they're these sacs, right? Like they're these sacs. And the lymphatic system is already very prone to stagnation because it doesn't have a pump like our cardiovascular system does. So when things aren't moving the way that they should, in Chinese medicine, we always have pain. Whenever there's pain, that is some kind of stagnation. Something isn't flowing the way that it should. So sometimes breast issues, we're looking at treating, we're not even getting into the hormone topic yet, but we're
Yeah,
getting into how can we improve lymphatic circulation in the body. And there's a few ways we can do that.
go for it. What can we do?
Yeah. One thing that I teach women a lot is the 5-minute daily breast massage.
Okay, cool.
You ever tried this, Emily?
No,
It's a
go
good
for
one
it.
to do it's a good one to do in the shower. You can get your favorite, there's lots of creams that are famous for moving the lymphatic system. Usually there's some kind of herbal base in there, right? But there's, you can add that, but you don't need to. So there's three parts to this. The first one is you do a little pinch and roll, right? So you just count to 100. You gently pinch and roll the tissue while you're counting. What this one is doing is bringing the circulation in. You don't want to you don't do this to the point of pain, but it's okay to have a bit of sensation there
Yeah,
while you're doing it. So we're bringing healthy oxygenated fluids in. Then you lift one and just rub underneath. So, a lot of women, especially those who are wearing a bra with an underwire, you get almost like scar tissue
yeah,
forms under here. This is not what we want for, optimal healthy breasts, right? We
no,
don't want scar tissue there. Nothing can flow through that. So you lift and you rub. This one takes a couple of minutes. You do it until it feels better, right? Like you're just giving them some love. And then you repeat on the other side. Same thing. Step 3 is you lift and rotate outwards. So it's like you're thinking about moving all of that old stagnant lymphatic fluid. You're using that main drainage point in the armpit. So it's an upwards and outwards. You do this for another count to 100, and you have just improved the lymphatic flow in the breasts.
I feel like you've had a lovely moment of just being completely present whilst in the shower. So you've like had a lovely sort of 2 minutes
Yes.
under hot water, not
Yes.
being able to think about all the stressful things because you're doing something.
Yes.
Oh, I feel like we've
Yes.
ticked lots of boxes there.
Yeah, there you go. I love the 5-minute breast massage.
Awesome. Okay, so once we've done that, we've now got happy breasts, which is a good thing. Obviously, whilst we're doing that massage, presumably we want to be noticing if anything is different.
Yeah, it has a really nice effect. You know, nature has a really nice way of giving us exactly what we need without us knowing exactly what we need. So, example, if that woman is feeling like, oh, my breasts are so engorged, then this will have, typically, it has the effect of reducing that. So your body's going to really like love that time when you move the fluid out, because that's going to give you some relief. Another woman might be going, "Oh my goodness, where have my breasts gone? Like they're just empty." This will have the effect of perking them up a little bit, pumping them up a little bit, you know, giving you a little bit of that self-confidence back. Ideally, right after the massage, like you'll be able to notice a small slight difference that will accumulate over time as you make this a daily ritual.
Oh, I love that. Who
Yeah.
knew?
Yeah.
So, okay, so that's something that we can all do really easily.
Totally.
Now
And
going in,
I have a PDF on my
oh,
website
cool.
that we can link to somewhere,
Yeah, awesome.
that
We will do that.
where someone
Yeah,
can download those instructions.
awesome.
Yeah.
So going now, sort of taking it to sort of the other end, somebody comes to you, you're doing lots of tests, you're trying to work out what's going on with her symptoms. How would, among all the other symptoms, obviously, how would changes in her breasts guide you to what you need to be testing, what you need to be finding out to be able to help her?
Yeah. Ah, that's a really great question, because it can be very difficult to speak to a woman about her symptoms and know exactly which hormone is out of balance, right? So always in perimenopause, menopause, we're talking about estrogen so much. We're talking about progesterone so much. It's really hard, you know, if somebody says, I have breast pain, then, you know, and this is always with the caveat that we have ruled out serious matters,
Of
right? We've
course.
already done that, right? So we're left with just, we're not sure maybe why, right? But we know there's nothing, no serious pathology.
Yeah.
It is very hard for anybody to accurately guess, oh, this symptom means this hormone, and then to also say it means that this hormone is high or this hormone is low. So if somebody comes to me with this major concern about their breasts, I'm testing. I'm
Yeah.
testing a lot of things to determine what the heck is going on here, right? Why do we have this? So then we would be getting information about estrogen, progesterone, you know, because those are really the main two when we're talking about breast health, because those breasts are so sensitive to both those hormones.
Okay. Yeah. No, that makes sense. And I know I'm just going to put this as an aside. I know we're going to talk about testing in a separate video, so I'm not going to
Sure.
go deep into the testing
Yeah.
now because that's a
Save
separate
it.
topic.
Yeah.
But no, that's interesting that it just shows up as another of the symptoms that people might be presenting with.
That's right.
I'm going to just throw one more question at you, and then I'll leave you to it.
Great.
So, what would be, aside from the massage, which just sounds blissful, and frankly, I'm doing it from tomorrow. What would be one other thing that people can do kind of straight away just to lessen discomfort in the breast area?
Yeah. A huge one, and people do not like me when I say this, but is caffeine consumption.
Oh, yeah.
Massive for breast discomfort, is the daily coffee. So, I hate to take away something that people love, right? But I tell them, hey, like, just try no coffee for 30 days and see if you notice a difference. And sometimes it's easier for people to stop doing something than to start a good health habit.
Yeah.
So I don't, by any means, I don't tell everybody to stop drinking coffee. No, 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 no. But in this specific instance, particularly if you have fibrocystic breasts, caffeine, not just coffee, but that includes like soft drinks, right?
Of course.
Chocolate, all the sneaky ways that caffeine sneaks into our lives. None for 30 days, and see if you notice a difference. And typically, most women, they really, really do.
Okay.
Yeah.
Awesome. Again, lovely, easy things to actually. I mean, I think for a lot of people, me saying that giving up coffee is an easy thing is probably not a particular.
Yeah.
It,
Yeah.
it's not a costly thing. It's not a thing that requires lots of external input. It's a thing that anybody could try if they're at the point of needing to. I'm
That's
glad.
it.
I'm glad right now that I don't like coffee.
You know,
Awesome.
some women too, right? They might be drinking 3 a day.
Mm, yeah.
So
So
maybe
I mean,
try just one.
a lot of people really do, use coffee as a really big crutch, and I totally understand that. I
It's
totally
true.
understand it. Mm,
It's true. Yeah.
yeah. Awesome. Thank you so much.
My pleasure. Thanks for having me.